Diabetes is a chronic condition that extends beyond physical symptoms to affect emotional well being. It requires ongoing daily management, which can be especially challenging for staff working in busy healthcare settings. Social determinants of health, such as financial strain, limited access to healthcare, or a lack of social support, can increase stress and make diabetes management more challenging. This study explores how these factors shape the experiences of staff living with type 1 or type 2 diabetes at community medical centers or CMC. We examine the connection between diabetes management, social determinants of health, and emotional well being with attention to symptoms of depression and anxiety. Little research has examined the experiences of healthcare workers managing chronic illness, and this study helps fill that gap. To do this, we distributed an anonymous survey to CMC employees with diabetes. The survey included validated mental health screeners, the PHQ-2 and GAD-2, which are brief evidence-based tools used to assess symptoms of depression and anxiety. We also asked about workplace stress, daily diabetes routines, financial strain, social support, and access to care. 14 staff members completed the survey, and one participated in a follow up interview to give deeper insight into how workplace and personal factors shape their management and emotional health.
Even with the small sample, the respondents revealed clear and consistent patterns among staff experiences. One of the strongest findings was the link between diabetes confidence and emotional health. Every participant who reported low confidence screened high for anxiety, while those who felt very or extremely confident did not scream high on the PHQ-2 or GAD-2. We also found that when staff had difficulty managing their diabetes routine at work, such as eating on time, symptoms were more common. Two key themes emerged from the quantitative and qualitative data. The first theme was confidence or workplace stress and organizational culture. Participants described understaffing, leadership pressure, and limited coverage. Several shared that heavy workloads made it hard to eat regularly, causing glucose spikes or drops and increased anxiety. The second theme was the protective role of social support. Staff who felt supported at home or by work coworkers consistently reported lower symptoms of depression and anxiety. In contrast, those experiencing financial strain or limited support were more likely to screen high for anxiety, especially when workplace demands interfered with their diabetes care. Taken together, the findings highlighted how diabetes management is shaped by workplace conditions and social determinants of health, and how those factors influence emotional well being for staff living with diabetes. This data shows that importance of supporting both work and at home in protecting staff health.
Some recommendations that we felt should be considered after analyzing the results is implementing stronger communication among staff and leadership to allow employees to advocate for themselves and their needs in managing diabetes. With this, we also believe that management should be more involved with increasing flexible scheduling for employees to create more time throughout the day to tend to their diabetes. Management being more involved in these conversations will help normalize asking for support in the workplace and create a safe space for more employees. Another recommendation worth noting is expanding behavioral health support and counseling services for employees in the workplace. During these routine check ins with employees, it is encouraged to use PHQ-9s and GAD-7s to screen for symptoms that may require intervention from behavioral health services. Given that participants in the study expressed a need for support in stress and diabetes management, it is evident that more attention should be paid to staff and their well being, with participants stating that with the extra backing, they feel fewer symptoms of anxiety and depression. It is crucial that management offers the support to allow their staff to improve their performance in both the care they provide to patients and their overall workplace well being. Thank you for listening.